Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we'll learn about birthing options and safety, poison prevention, and kidney health. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. I don't know if you realize this, but you can basically customize your birthing experience these days. And here to discuss this is Amy Wilson with Saint Thomas Health. Good to have you here.
Thank you for having me.
I know that you recently, Saint Thomas has opened several new birthing suites in your facility. Tell us which facility and what this birthing center offers.
Okay, great. So the birthing center is at Saint Thomas Midtown, and it opened in the fall of last year, and we have 3 new birthing suites, and it really offers a home-like environment inside the safety of a hospital with trained personnel, physicians and nurses to be able to assist with the delivery if necessary.
All right, we know that there have been multiple ways for moms to experience childbirth, and this is the most important, one of the most important times of a woman's life is giving birth to a precious baby. We know that this isn't available though for everyone. Who specifically can utilize this facility?
Absolutely. So we're really looking for moms who are low risk, who have healthy babies, and this is a viable option for them in order to have what we would call a low intervention or natural birth. And so there are interventions in the room for them, like labor tubs, birthing balls, squatting bars, things to help with their labor, to help it progress, to ease their comfort and really offer them more of a home-like environment.
Well, that makes sense. That really does. You've had this since the fall. What has been the response? What kind of feedback are you getting from the moms and their families?
The response from the community and the families has been wonderful. Being able to have this option inside of the safety net of a hospital has really been something that our community has needed, and it's been embraced by our community. And we're really pleased to be able to offer this to our new moms at Saint Thomas. We really believe that the birthing options for moms should be whatever mom wants them to be. So anything from the birthing center all the way to having full medical intervention if that's what mom would choose.
Okay. Now we know that there are obviously high-risk infants, high-risk situations for, I don't know what the percentage is, but for them this isn't necessarily an option. So what are the options for those situations?
So for any mom who's determined to have a high-risk pregnancy, that would be a decision made by her OB/GYN. She would often be referred to a maternal fetal medicine specialist as well to help manage her and the baby along with the OB/GYN. And for any mom that needs to be admitted to be watched during this pregnancy, we have a very high intensity antepartum unit that provides interventions to mom while also offering comfort and relaxation in order to still maintain her pregnancy in a comfortable environment.
Okay, what are some of the other birthing options? You mentioned briefly the tub, the labor tub. Can you go into more detail about that?
Sure. So one of the interventions or the options for moms while they're laboring that helps provide a soothing, comforting environment during the labor is the birthing tub. And so mom can actually labor in this tub. We don't actually do births in the tub, but she can labor into the tub until the time for the baby to arrive.
What are the benefits of that? It sounds much more relaxing, but what are the health benefits of that?
So it helps with the contractions, it helps with pain control, provides soothing and comfort to mom and baby so that she can labor and progress appropriately during the birth.
Okay, what about midwives? The use of midwives during this
So again,
experience?
That's really up to mom to decide what is appropriate for her and her baby, as long as she and her baby's health is a low-risk birth. She's able to choose a midwife if that's something that's important to her, or she can have her OB/GYN in the birthing center as well.
Are there opportunities for the entire family to be part of this whole experience, or certainly the partner?
Absolutely. So we really customize that again to mom about what's important to her and to whoever is important to her in her life. So we'll customize that as well.
Total customization.
We try as much as we can, as long as mom and baby's health allows us to do that. We do try to make sure that we're providing what's important to her, because as you've already pointed out, this is a really important time in the mom's life and in the family's life. We want it to be a wonderful experience for them.
And I'm sure you want it to be inclusive, you know, if there are
Absolutely.
other siblings,
Yes.
to make them feel part of that as well. Not that that's your job, but the experience.
Yes, absolutely.
Go ahead.
So we also offer sibling classes. So some of the we do. So some of the classes for mom as she's preparing are obviously the childbirth classes, which will help mom and the family or her significant other, her spouse, during the labor. But we also have sibling classes. So if mom already has children at home, the siblings can come participate in classes and learn what to expect from a new baby brother or sister.
Well, I've never heard of that. Is that something fairly new, or has that been going on for quite some time?
So we've been doing it for a little while at St. Thomas, and we get great feedback on these classes.
I'll bet you do.
Absolutely.
I'll bet you do. How about some of the other educational opportunities and support groups that are available?
Right. So once baby's here, then mom also has breastfeeding classes available to her if that's something that she believes is important to her. So there are support classes that she can attend. We also have a lactation center that provides full service of lactation needs, anything that mom and baby need during that time as well. And
yeah, just the full
Absolutely,
spectrum.
yeah.
Now, I know that you have a lot of personalized things. Again, going back to the customization, tell us about some of the other amenities. Is it lighting I'd read about, and music? You mentioned labor tubs. Tell us about some of the other things you have in the birthing suites.
Absolutely. So there is customization for music in the labor rooms and the labor suites. There's lighting that can be dimmed or brightened to make mom more comfortable during the labor. There's also scents that also help with the relaxation, aromatherapy as
Essential
well.
oils, all of
Essential
that.
oils, all of that, yes.
Fantastic. And to get more information, where do we go?
stthomashealth.com/births.
Okay, all right. Thank you for painting a lovely picture of us of these birthing suites. And it's so nice to know that this is out there for families, for new moms. Thank you, Amy.
Thank you.
Thanks for coming in. And we'll be right back with more after this. Poisoning is a much more significant health problem than many of us realize. In fact, it continues throughout life. It's not just with little kids getting into the kitchen cabinet, getting into cleaning products and all that kind of thing. Josephine Darwin is here from the Nashville Poison Center. It's good to have you back, Josephine.
Thank you.
I know you were on previously.
Yes, thanks for having me.
Good to see you. So poison can take many forms. It isn't just the kids getting under the sink, little toddlers. It can it can extend throughout life with mixing up meds. What is poison? I mean, we think of just anything toxic, like I can go back to cleaning products.
Sure. That's probably the most common thing that people think about with poisons or cleaning products. But a poison is anything at all that can make you sick, hurt you, or even kill you if it gets inside your body. And of course, the easiest way for a poison to get in your body is through your mouth by eating or drinking something. That could be a medicine, it could be a cleaner, anything like that. But poisons can also get into your body through your skin. That's a snake bite, spider bite, poisonous plant, or your nose by inhalants, huffing, things like that, or through your eyes by spraying or splashing something in your eyes. So, and anybody can be a poison victim.
I hadn't thought about it.
I know.
In entering the body in those other ways.
Right. We handle all types of poisonings.
I had no idea. I had no idea. Okay, so many of these are accidental kind of situations, and then there's some that are intentional with drug abuse and suicides, that kind of thing. So what do you do at the Tennessee Poison Control Center? I mean, you are a 24-hour, 7-day-a-week operation,
Right.
basically.
Our primary program is a poison help hotline. Tennessee Poison Center is the only poison control center in Tennessee, and we serve all 95 counties. We're based at Vanderbilt, but we serve every county in the state. And our hotline, the 1-800-222-1222 number, is a free medical hotline for anyone to call if you suspect a poison. And last year we had over 50,000 calls to the hotline.
You are kidding me.
Yes, we have medical professionals who answer the phone who are full-time staff of the Poison Center. They're not dispatchers or volunteers, and they answer between 200 and 300 calls every single day.
They have to be very educated, obviously,
Yes.
on the exposure and what it means and
Right.
what somebody needs to do if someone in their
Right.
home has been exposed to something poisonous. I read in some of the literature to prepare for the show that there are more cases of poisoning than injuries from car accidents, or is that correct? Do I
That
have
is
right?
correct.
And that blew me away too.
Yeah.
That statistic or that information.
I think everybody's shocked to learn that poisoning is the leading cause of injury death in Tennessee, ahead of motor vehicle accidents, gunshot wounds, drownings. I mean, most of it's due to the misuse and abuse of drugs. Tennessee has a very bad prescription drug problem. The national average of prescriptions per capita is 12, and in Tennessee we have 17 per person.
Are you involved in campaigns to educate people? I mean, obviously this is an educational moment with doing this. Do you do a lot of educational programs?
We do a lot of educational programs, and we work with the UT extension educators in every county to do programs, not primarily on drugs, even though that's part of our programs, but just on how to prevent poisonings in general. A lot of it is common sense, like putting things in high lock cabinets, but you know, it's things people just need to know about and refresh themselves on.
You know, there are probably a lot of incidents, I would imagine, even this time of year, flu season, with people maybe mixing prescriptions, over-the-counter things, depending on what other illnesses they may have, chronic conditions. Is that true?
Yes, we have a lot of calls about people who don't read the label. Either they take too much of a medicine, they give too much of a medicine to a child, they take an over-the-counter medicine not realizing that acetaminophen is in an over-the-counter medicine, and then take it in a prescription medicine, and then that can cause problems. We always like to say, make sure you read the label, and if you have glasses, make sure you have your glasses on when you read the label of any kind of medicine.
Okay, I don't want to put you on the spot here, but like, let's say you overdose or take too much acetaminophen. What kind of side effect, what would the illness be?
Well, it totally depends on the age, the weight, and you know, how long ago, a lot of things. And since I'm not the medical professional, what we always like to say is to call the Poison Help Hotline as soon as you suspect a poisoning. And another thing is, don't wait for symptoms. If you walk into a kitchen and see a baby there with some cleaner on the floor and you're not sure if they have had any, you want to call the Poison Center, and we can talk you through it and find out.
And most of the time you could probably get someone to a point where they're stable, or they get the help quickly, because time is of the essence, isn't it?
70% of our calls are managed at home under the monitoring of the poison specialist. And so that's why poison centers were started in the first place, is to keep people out of emergency departments when they don't need to be there, and save those visits for someone who really needs it.
Okay. Is there a call that has really stood out or made an impression on you from someone?
Well, there are lots of calls, but I'll say one that really made an impression on me, and I thought it might have been just a one-time incident, but it was a senior who picked up super glue on her nightstand instead of her eye drops and put them in her eye. I just couldn't believe anybody that would happen, and I thought it might be an isolated incident, and no, it happens not frequently, but more than once.
Oh my goodness. You know, you do hear about, I have a friend whose in-laws had switched medications. They were elderly, and she was taking his and he was taking hers, and obviously they weren't doing so well. And it wasn't until their children got there, the daughter-in-law and her husband saw what was going on. And so that's probably fairly common too, huh?
Yes, that's very common. Most of our calls are for children, about 58%, but then our second largest group are for older adults.
Okay, so what can we do to prevent this in the first place? You mentioned keeping things, as far as children go, up higher
Yes.
spots in the home. What
And
else?
also with medications, most of the prescription medications that teens and young adults find are found in their home or in a friend's home. So if you have prescription medicine, you need to keep it locked up. If your medicine has expired, you don't use it anymore, you need to get rid of it. And there are several places, which I know you've had someone on your show
yes.
talk about that, but get rid of medicine. Don't call medicine candy. Those
No.
are some of the big ones.
All right, Josephine, thank you so much.
Thank you for
Very
having me.
educational, very enlightening. Appreciate it.
Thanks.
All right, and we'll be right back. Thank you. Our kidneys filter all the blood in our bodies every 30 minutes, and so obviously functioning kidneys is vital to good health. Heather Powell is with the Nashville Kidney Foundation. Thank you for coming in.
Thanks for having me.
To discuss this. It's Kidney Month, National Kidney Month, and we know that kidney disease is extremely prevalent. Why is that the case?
Well, in Tennessee in particular, it's prevalent for a number of reasons. Two of those are that the leading causes for kidney disease are hypertension and diabetes, and the rates of those two diseases are particularly high in Tennessee. Overall, the health of Tennesseans is not as good as maybe we hope it would be, so we do see a higher risk and rate of kidney disease here.
And what is the cause of that? What has led to that problem in our state?
Just general health, access to health care is an issue in Tennessee. People just being able to visit their primary care physician and get that ongoing care that they need to maintain their overall wellness and health. But hypertension is a big problem, and addressing things like hypertension and diabetes early can really do a lot to help prevent kidney disease down the road.
Give us a little primer, if you would, on the function of our kidneys and the filtering process and what exactly the kidneys do.
The kidneys are really awesome organs, and they're organs that people just don't talk about a lot,
No.
but they're very important. They actually filter the blood in our body, and so like you said, they filter many quarts very frequently throughout the day, really all the time they're filtering blood. So they take all the things out of your blood that you don't need to make your body work, essentially. So when kidneys start to slow down or the function gets diminished, things start to build up in your body that shouldn't be there, toxins and waste and things like that should not be a part of your body, and that's when health starts to decline. So kidneys everybody has two, or most people have two. You can actually live with just one, which is really a unique feature of kidneys, which is why living kidney donation is such an awesome ability that lots of people have and affects the lives of lots of people who have kidney failure, but kidneys are constantly working.
Yeah, that 30-minute, I didn't realize how often the filtration process was happening in the body. So warning signs if there is a kidney problem. Obviously, if you get regular physicals and you look at the different numbers, your lab work, doctors can see if there's a problem. But what are some of the warning signs?
Well, one of the problems with kidney disease is it's called the silent disease, and that's because there are often no symptoms until people are so far down the path with kidney disease that there's no turning back. So there are stages of kidney disease like there are with lots of other diseases, stages 1 through 5, and about 90% of people with stage 1 through 3 don't know that they have kidney disease because they haven't seen any symptoms yet. When they do start to present, you'll see things like swelling, chest pain, changes in urination, things like that. But really the only way to test for kidney health is to have specific tests with your doctor, or with organizations like Tennessee Kidney Foundation. We provide free kidney health screenings for the community.
I'm looking at the warning signs up on the screen. If we could go back to that for a second, there was quite an extensive list. It says even back pain, itching. That can be one of the signs. Loss of appetite. I mean, that's sort of a vague thing.
It is, and a lot of those symptoms can be vague, and they can be attributed to other things, and not things that make you think about your kidneys right off the bat. So it's always important to, if you have risk factors for kidney disease, like hypertension, like diabetes, or family history of kidney disease, things like that, to keep an eye on kidney health with either your doctor or seek Tennessee Kidney Foundation out and have a free kidney health screening.
What are some of the treatments for kidney disease?
So if you catch it early on, there's a really good possibility that you can hold kidney disease where it is and keep it from progressing.
Keep it stable.
Right. So you can do that through managing your diet. There's something called a kidney-friendly diet that you can follow, really to work with a dietitian to look at nutrients and proteins and some things. It's a very specific group of foods that you should eat and should avoid if you have kidney disease to kind of maintain kidney health. Outside of that, monitoring blood pressure. If you have high blood pressure, take the medication. Don't skip a dosage, because high blood pressure it both contributes to kidney disease, and kidney disease can also cause high blood pressure. So you kind of get it from all sides with hypertension and heart disease. If you have diabetes, manage your glucose and your blood sugar. Just some of those maintenance type of things can really help to prevent kidney disease from progressing. But once you do go to stage 4 and 5 kidney disease, that's kind of the point where you can't walk it back, and the options from there are really dialysis and transplant.
Let's go back to something you said a minute ago about foods to eat and not to eat. So let's talk about what are the good foods for kidneys.
Well, it's really particular to the person. So one of the resources that Tennessee Kidney Foundation has, we have a renal diet handout. So you've probably heard of things like Eat This, Not That, and those types of food programs. Well, we do something like that in this dietary handout that we have. It was developed by dietitians and with the supervision of physicians. We've got categories of foods: foods to eat, foods to enjoy, foods to avoid. And it's something that we recommend people hanging on your refrigerator, keep it somewhere close by, so that when you go to the grocery store, if you're going out to eat, you can refer to that list.
Make it user friendly. I think you kind of answered this previously, but I'm going to ask it again anyway. Can you do anything to prevent it, kidney disease? I think it's probably common sense, but
it is very preventable. So just general health is the most important thing. If you can avoid hypertension, if you can do things that, avoid things that cause heart disease or high blood pressure, you can also help avoid kidney disease, and the same thing with diabetes. But once you have those conditions, if you can try to keep them under control with medication, that can really help prevent the onset of kidney disease.
It says even, get tested if you're at risk. What would make you at risk? I think you alluded to that earlier as well.
Lots of risk factors outside of hypertension and diabetes. Age is a risk factor, so people who are over age 60 are higher risk for kidney disease. African Americans are 3.5 times more likely to develop kidney disease than any other group of people. Hispanics and Native Americans are also at higher risk for kidney disease. How can we get more information for people watching? TennesseeKidneyFoundation.org is a great resource. You can call us. People call us every day to ask, I have a family member who's at risk, or I've been recently diagnosed with kidney failure. What can I do next? And we've got lots and lots of educational resources we can provide.
All right, Heather, we really appreciate you coming in and sharing your knowledge at a time when we really focus on good kidney health.
Thanks for having me.
Thank you. Thanks so much for coming in. And thank you for watching Community Health Matters. You can learn more ways to improve your health on our website, mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.